Welcome, and thank you for joining us today. Today's presentation will be an overview of the Federal Emergency Services Program. The topics covered in this presentation are the federal definition of an emergency service, claim submission and billing requirements, medical review and documentation, and post-payment review. Questions about this presentation can be submitted via email to providertraining@azccess.gov. So let's get started. What is the Federal Emergency Services Program? AHCCCS provides emergency healthcare services through the Federal Emergency Services Program. The FES program only covers emergency services that fully meet the federal definition of an emergency service. So who may qualify for enrollment in the FES program? Members that are eligible to be enrolled in the FES program are Arizona residents who meet all requirements for Title XIX Medicaid eligibility as specified in the Arizona State Plan, except for citizenship. Now let's talk a bit about the services and limitations. AHCCCS covered services will be considered only. FES members are only eligible to be enrolled in the fee-for-service program. Claims for services are reimbursed by the AHCCCS administration on a fee-for-service basis. Emergency services do not require prior auth, with the exception of outpatient dialysis services. Services must fully meet the federal definition of an emergency medical condition to be covered. Coverage determination is based upon medical review, and all services must meet the federal definition of an emergency service to be covered. Now, what is the federal definition of an emergency condition? The federal definition of an emergency medical or behavioral health condition means a medical condition which includes labor and delivery, or a behavioral health condition manifesting itself by acute symptoms of sufficient severity, including extreme pain, such that the absence of immediate medical attention could reasonably be expected to result in the following: placing the member's health in serious jeopardy, serious impairment to bodily functions, serious dysfunction of any bodily organ or part, and serious physical harm to self or another person, and this would be for behavioral health conditions. Now let's talk a bit about the medical claims review. With the stipulation that only emergency services are covered under the FES program, this includes services provided in any setting, for example, inpatient, outpatient, or a physician's office. So how does the administration determine if services are covered? Each claim is reviewed on its own merits. Medical review is performed by a team of professional nurse reviewers. Medical documentation is required with each claim submission. Providers also have an option to allow remote access to health records. Medical records must support the emergent nature of the services provided. All claims submitted to fee-for-service are subject to retrospective review to determine if an emergency existed at the time of service and to ensure that emergency criteria were met. Now let's move on to completing the claim forms. Claims for emergency services must be billed with the appropriate emergency indicator codes. Services submitted on the CMS 1500, make sure the EMG field is checked, and for paper submissions, enter a Y or X in box 24C. On the UBO4 form, enter the type of admission code 1 to indicate emergency visit. Now let's do a knowledge recap. All services must meet the federal definition of emergency services in order to be considered for reimbursement. Prior authorization is never required for FES members. All claim submissions must include the appropriate emergency status indicators. Medical review is considered on a case-by-case basis. Medical documentation is required with each claim submission, or AHCCCS must have remote access to the health records. And all claims are subject to retrospective review. This concludes the overview for medical services for members that are enrolled in the FES program. To view additional information, providers can refer to the AHCCCS Fee-for-Services Provider Billing and Policy Manuals by clicking on the links provided below. Thank you.